All right, we are back for another edition here. I Never Knew TV live version. Groundings with my brothers and sister Holistic Health Conference, Philadelphia, next Saturday, October 12th. And we are here with one of the presenters, Deborah Hinds, MPH certified group fitness instructor. Deborah, what's going on?
Hello. Hello, everyone.
You know, it's wild. I probably haven't called you Deborah in years, which is weird, but we'll talk, we'll talk about that. So we gonna we're gonna get right into the reasoning, right? So today the topic is we're gonna be focusing on why the health system's failures hit Black women the hardest, right? Um, in preparation for this reasoning, you presented me with some information from the U.S. Department of Health and Human Services Office of Minority Health, which claims, and I use the keyword claims because you know how it is with the statistics sometimes, about 4 out of 5 African American women are overweight or obese, right? The question I have for you is why do you believe obesity is so high in African American women?
Okay, so first, this data was published on the Department of Health and Human Services Office of Minority Health website, but it's actually from this national survey that's done every year. It's called National Health and Nutrition Examination Survey, and it's administered by the CDC, like many folks, courtesy of this pandemic that we just not really exited because we're still in it. They are the ones who, the Center for Disease Control and Prevention, they're the ones who commission, administer the survey, and also does the analysis. So it was the Office of Minority Health that just posted the results from this analysis. Um, and to know more about the survey, I like to encourage people, if you ever are afforded the opportunity to complete one of these surveys, please do so. I've never got notification of participating in any of these, and they are supposed to be like nationally representative. So they're getting a sample from the population is about 5,000 individuals. So that's the sample size, and that's where they draw this information from, just to provide people with some context on this survey. So it is done every year, and part of it is like self-report from the individuals 18 and older that take the survey, and then there's a component with actually a physical assessment, including laboratory tests, and it's from medically trained staff that do this. So that's just some context on the survey where the data has come from.
No, I just wanted to know though. I wanted to jump back to the question: why do you believe obesity is so high in African American women?
Um, I think it's multifactorial, but like a more encompassing answer is not they, because I'm a part of it. So we have been failed by the society as a whole, and specifically the healthcare system has failed us, currently does fail us, and continues to fail us. And there's like many parts that folks like to point to, like behaviors, individual behaviors, on like your nutrition choices and your physical activity. But there's something called the socio-ecological model, right? And it provides context to like the decisions that we make regarding our food and our food choices and our level of physical activity. And so it includes, like, there's this large hexagon, right? And on the outside of it, it's social and cultural norms and values. So that's people's beliefs, their religion, and also just like their heritage. And then you have, what is it? It's the social and cultural norms. And then you have the influences, social influences, and that includes like government influence by public health and healthcare systems. And then also they call it sectors of influence, which includes like the government, also includes, what is it, industry, like food, beverage industry, your community design, and also what are some other ones? Entertainment, marketing, advertising, all of these. And then after that is environmental settings, right? And that's like where you live, your community, where you work, where you go to school, recreational facilities, the food and retail establishments in your community. And then last on the list is individual factors. People, even in that page, the Office of Minority Health, where they presented the facts, they also included that one statistic that I think served to place blame on individual behaviors. They showed the statistics on the percentage of Black and white people who participate, who do not participate in activity. And I think that tries to place the blame on the individual. But when you look at the socio-ecological model, individual factors are at the dead bottom. It's other systems that impact and influence the decisions that we make.
All right. So like with the information that you have gathered, right? So from what I'm hearing, it's kind of irresponsible to criticize someone for their struggles with obesity.
It really is very irresponsible because it's never just one factor that contributes to like any outcome, but specifically a health outcome. And there have been studies that show that it's like chronic levels of stress. So when you have high levels of cortisol in your blood, and that's a hormone, it's very needed and it has very important factors. But when you have high cortisol levels, that can lead to high blood pressure and diabetes. And those are two outcomes that are prevalent in the Black community, including Black women. So that it's stress. And I think many, I'm not going to say all, but many Black people live under chronic stress. So if your body is under chronic stress, you're going to have negative impacts to your organ systems, and hence you're going to see these outcomes.
And I'm glad you brought up the stress because a lot of times when people talk about health and talk about healing, they don't factor in how stressful it is to live in this society. And like you have to, I don't want to say you have to overdo it, but you have to work very hard to meet some form of health in this environment, you know?
Yes, it's kind of impossible. Although I try to, it's a battle every day, and not even just every day. It's like every second, every minute, every hour of the day. This society really doesn't support, and I think that's one of the failures. It does not support a healthy lifestyle, and
Facts.
it's because it benefits from it. Like you really have to make an intentional like choice to eat healthy, to like avoid things that are detrimental to your health. And it's not easy because a lot of these things are tempting. It's tempting foods, and then they make like the healthier options seem unattractive and unappealing. So it's very difficult. It's not easy, and you
What?
can't do it alone. It really is important to have that social network, that positive social network.
That's the part too. The social network, I think, is very rough for people because it seems like, in my personal experience, which is limited, but from what I hear from others, is that when you try to go on that health journey and try to improve yourself, you're actually scorned to a certain extent and ostracized. So not only are you trying to pursue something that's very difficult, the support doesn't seem there. Like in your work, are there support systems for people trying to improve themselves?
I mean, I don't know of any organizations that like help with this. And I don't think, because we don't have a lot of primary prevention resources. And we'll talk about this later when we talk about the failure of the US healthcare system, but it's not really set up to offer those primary prevention methods. Is really just find, you kind of have to find your people, people that are like minded. And I don't like, some people say you stay away from those people who may dissuade you from following this path, but then who's going to be their example, you know? So maybe you have to add those, you have to find, like, they have a lot of groups. They have like Black Girls Run. And with social media, you can really tap into these different groups. There's a lot of Black women-centered health groups. And there's a group called Black Social Girls Club. I mean, and they have like, it's a lot of opportunity to engage with like-minded individuals who will support your health. And I don't think you leave those who are not on, they're not in the contemplative stage of that trans theoretical model of change. They may be pre-contemplative, but your example will help them. But it is important to add. Sometimes it's more difficult to take away, so you can find like another alternative, which is to add those people who are like-minded. And if you're able to attend a gym, then you're really going to be surrounded by people who are like-minded, and you're going to pick up tips on like how to exercise and even get some nutrition in there. So
No,
just like adding those people to your circle.
no facts. And the second question I have is there's another thing you sent me. There was a recent report that stated the U.S. has the highest rates of preventable and treatable deaths of all ages, as well as excess deaths related to pandemic uh, for people under the age 75. Right? How much of the preventable and treatable deaths in America are caused by its healthcare system, and how much of the preventable and treatable deaths are caused by the stressful American culture that encourages people to overconsume in all aspects of their lives?
Again, for this, the response to this question is multifactorial, but it's both factors that you mentioned. It's the failure of the health system, because as I mentioned before, it really isn't set up
It's not in the
to
business model.
highlight primary prevention, because in the short term, primary prevention may be costly, but in the long term, it's actually cost saving, cost effective. And also, it's not making folks money, as opposed to having a sick population, a large percentage of your population being sick, and then you can benefit from pharmaceutical needs. Like they're going to have to buy medications that, by the way, is very expensive in the US compared to other countries. Like we're talking sometimes maybe $1,000 or thousands of dollars more for the same medication here folks are paying than in other countries. So it's like it's profitable. And I think somebody needs to find a way to make primary prevention profitable, make it look sexy or something. I don't know. Because if it's not profitable, we're not going to have buy-in, and this country, this healthcare system will not prioritize primary prevention. And that's when you avoid getting a condition or illness. That's what I mean by primary prevention. What they really focus on and what this healthcare system is like based on is secondary prevention. That's when you have screening and testing. So by that point, you can already have developed that sickness or that condition. It's just maybe like say for breast cancer screening, if you find it sooner rather than later, you'll have a better, more positive prognosis, as opposed to finding it later, but you'll still get it. Wouldn't it be nice if we didn't get it at all, you know? And there are primary prevention methods that would prevent someone from getting ill. And then you have like tertiary prevention. That's where they really make the money. That's when treatment comes into play and some sort of rehabilitation. So a lot of it is secondary and tertiary prevention methods. And that's why we have the worst outcomes of most wealthy countries, is because we don't focus. We don't put the money into primary prevention.
No, serious thing. And for those unaware, Deborah Hinds will be presenting at Groundings with my brothers and sisters. Can you share what you'll be speaking about during your session at the conference?
So like now I'm talking about how the system kind of dictates our health. But here for this session, it's called Smart Health. And the SMART stands for specific, measurable, attainable, relevant, and time-based goals. So we're going to focus on creating goals for our nutrition and for our fitness level. And it's really to kind of combat what we're up against. And that's really why, that's one of the, I think it's tied for three, why I do what I do in my fitness journey. What really drives me to eat well and to exercise. One, it's to prevent any condition or illness developing with me. Like, I want to try, like many people, they do need medication, but I want to avoid it as much as I can. Also, it's kind of like my resistance, my fight against the system. I don't want to be one of those statistics. And I know, as I mentioned, there are many external factors that may dictate our health and our health journey, but there are those intrinsic factors, those things that we can control. And this session is really about like taking as much control, taking back control of your health and starting making a goal, a plan to do so. So that's what we're going to do.
All right, and we're definitely looking forward to it. And I appreciate you coming to Groundings with my brothers and sisters, and I appreciate you coming on tonight, sharing that vital information. Deborah Hinds will be at Groundings with my brothers and sisters alongside Muda Baruka, Styles P, Nori Muhammad, the Jasmach Kwasi, Midwife Asasia, Dr. Dorothy, who was just on, and Lawrence Ija. How long is your session?
I think it's like 50 minutes. I'm only really talking for 20 minutes. The last like 30 minutes is us working on the plan together.
And I'm glad that you chose that topic because what I've learned over the years is that one of the biggest pitfalls people have on their fitness journey or health journey is that the scheduling they have is unrealistic and not, I shouldn't say unrealistic, unsustainable. And when it's
Yes.
unsustainable, it becomes discouraging and it limits the probability of them sticking with it. So I'm pretty sure people who will be there will be exposed and will be assisted to create a sustainable model that they can follow when they go back in the world and they
We
do their.
lost you. Your screen went black.
Can you hear me?
I can hear
It's
you.
all good. It's all good. So
Yes.
we're thankful for everything. Thankful for everyone tuning in.
But wait a
Does
minute. Yeah.
anyone?
So
Does,
that's the goal, right? To create feasible plans that you can do long term. So it's never like, oh, I gotta go on this diet. When you have sustained health and fitness, then there's no need to do those crash diets, and you just want something for the long term. That's it.
all right. Does anyone have a question for Deborah Hines? Please put it in the chat if anyone has a question for Deborah. Tanya Macy said, "Great information."
Or that's T. Hey T. Oh
Uh,
yes, devastating. And it is by design because they have like zoning laws, zoning policies where you're supposed to have like a certain amount of like supermarkets in the area. And then there are places where some communities where they don't even allow an excess of like liquor stores, but they don't really address these food deserts.
conference. I'm gonna ask when is the conference? Conference is October 12th in Philadelphia. I just put the link there for all the information at Eventbrite if you want to purchase a ticket. Any more questions for Deborah about this health system or uh, nutrition?
And I can answer any other questions at the conference.
There we go. Give thanks for everyone tuning in. Deborah, thank you so much for your time again. Thank you for sharing information. Looking forward to your presentation at the conference. Give thanks for everyone tuning in. As I said before, also remember Groundings with my brothers and sisters Holistic Health Conference is next week in Philadelphia. I have a question here, real quick, before we cut. What kind of prevention projects would be useful to the communities?
Prevention projects. Um, I don't know about like a prevention project, but I think it's best to start at the individual level, right? And then expand to within your home. And then maybe that can overflow to your community. But it's really focusing on and making a plan of what you're putting into your body, what you're bringing into your home that kind of controls what you put into your body, and trying wherever possible to include some physical activity. And that can include just like walking. Walking, it may seem basic, But if you do this consistently, then that will have a significant impact on your health and your fitness level.
And we have another question here from Geometry. I believe it's Dr. Dot back on. Is that Dr. Dot sneaking into the chat? Will your presentation address low cost alternatives? Most argue that eating healthy is too expensive.
Yes. We'll have some solutions because during that session we'll identify barriers that may be preventing us from reaching our health and fitness, well, nutrition and fitness goals, and then together we can figure out some solutions around those barriers, and that would include like cost control.
All right. We have one more. Importance of citrus. Let me put it up here. Says the importance of citrus, right? The scoop on vitamin D, foods that you can take instead of high blood pressure medication. You want me to take that one? All right. So,
Citrus is for the vitamin C, and vitamin C is very important. I mean, it has many different functions in your body, but it helps with like resistance of infections, right? It strengthens your immune system. It's important for like collagen development, and that's an important component in your body. So you don't even just get it from citrus foods. I think that's a common, not really misconception, but people just limit it to citrus foods. You can get it from broccoli, you can get it from papaya, you can get it from many fruits and vegetables, but it's a lot like a lot of the green vegetables you can get your vitamin C. And what was the other parts of the question?
uh,
Vitamin D.
foods that you can take instead of high blood pressure medication.
Well, I think for many people, especially in the Black community, it's stress. And I just mentioned that when I talked about like the importance of like cortisol regulation. If it's too high, then that can lead to high blood pressure. So you really want to engage in those activities that limit your stress. Yoga is a great one. It's just trying to avoid as much stress as you can. And then also for the food you eat, you don't want to eat foods high in salt. It's not really like you want a well balanced diet, period. But there's certain things that you want to minimize your intake of, and high sodium foods. Pay attention to your labels. And we may touch on that, I think, during the session, is like a very useful tool of reading the food labels so that you can make conscious decisions when purchasing foods.
Respect to Mama Southall in the chat. Straight from Cali, give thanks. Saying,
Hello.
we have another one here. Let me see.
I don't think I mentioned, right, that, and I think everyone should know this, and they probably do know this, is that the US has like the worst healthcare system. In the study that was mentioned in this, when they compared the 10 countries, the US ranked last in overall performance of their healthcare system and in most of all. I saw the picture. I saw a profile picture. Yeah, so the U.S. ranked last in pretty much all of the 4 of the 5 categories, and only scored relatively high in one. But were you asking a question? You were about to ask a question, or somebody had a question in the
um,
chat.
says I agree with starting with the individual as ethical culture of food plays a big part in the individual diet.
Mm-hmm. I agree as well.
Someone says here, Don Washington, you have to balance sodium and potassium. You need salt, but the right type.
Mm-hmm. Yes, because sodium and potassium, both minerals, are important for your nervous system. I don't know how many people have studied biology, but it's the sodium potassium channel that's really important, is essential to the transmission of signals down your neurons. So it's very important. It's not sodium is bad, it's the added salts in the food, table salt, that is no bueno. If you look at a food label and it says like 20% or more of sodium in one serving, you want to kind of shy away from it. Or if you consume it for the rest of the day, you don't want to consume high sodium foods.
A serious thing. Any more questions in the chat for Deborah?
I can't wait to see you all there.
No, we have thank you there. So, Deborah, once again, we really appreciate your time. I am looking forward to your session, helping the people figure out a sustainable, applicable schedule for their nutrition and their workouts. And give thanks for everyone tuned in. I'll put the link again once more in the chat if you are interested in attending Groundings with My Brothers 2024 Holistic Health Conference. Styles P will be in the building alongside Muda Baruka, wonderful Nuri Muhammad, Lawrence Aja, Dejas Mach Kwasi, Midwife Asasia, Muda Baruka, and I believe I said everyone. Great event to meet like minded people. Great energy will be there. I guarantee when you leave, you will leave with things that are applicable, not pointless information. I'm not going to tell you it's a life changing event, but you're definitely going to learn things you can apply. So we encourage you to come out if you can, and we look forward to seeing you. All right.
All right. Thank you.